Good to have you guys back. How are you all doing? So, today there's an interesting topic for you guys. Today we're talking about the ideal skincare routine for oily skin type. Now, I don't know, for those who are following me on my page, have subscribed to my channel, or have seen one of my videos, I made a detailed video on how to know your skin type. If you've seen that video, then it will be easier for you to understand what I'm about to teach you guys. Or yeah. So the thing now is a brief recap. There are different types of different skin types we have. Okay. We have the oily skin, the combination skin, the normal skin, and the sensitive skin. It's very important. It's really, really important that you go and watch that video I posted. It's really detailed. If you watch it, then you have a clearer picture of what I'm about to teach you today. So, guys, now I know oily skin. Those that have oily skin, ha, God, I actually pity this those set of people because it's actually serious, like almost war getting what to actually work for you. Okay, so I know how it feels. So today I'll be giving you a detailed lecture on what what you need to know, things you need to avoid, things you need to understand first before getting the skincare products. Like if you get the basics, you understand the basics, then fine. You can actually walk into a store and get something that works for you. Now, excuse me, guys, I'll be looking at my notes, not totally like all through, but I wrote down some points that will actually help me. At least not to forget some things I need to say, right? So first off, I'm going to give you an introduction to what an oily skin is. An oily skin simply means when someone says you have an oily skin, it means that your body produces excess sebum oil. Sebum means oil. So your body produces excess oil, excessive oil, okay, than usual. Now, if your body produces that, it's it could lead to a whole lot of things, which I'm not going to go into now. But just understand that oily skin, someone who has an oily skin has an excessive production of oil on the face. Okay. So now, how to know that you have an oily skin? You have to watch that video. But for the sake of those who are here and who watch this video, I'll just give a little description. Now, first off, how you know an oily skin is that you wake up in the morning. The first way you can actually find that out is you wake up in the morning, just get your mirror and you look at your face, and you find out that you have oils distributed all around your face, like every part of your face, you have oil on it, like it's glossy or whatever. Yeah, glossy. Then you know you have an oily skin. Okay, hold on, guys. Please let me share this live to people, some other persons. Okay, so just a minute. A minute, guys. Please let me just share this live so some other persons can join and enjoy this lecture with us too. Okay, hold on, guys. Please, I'm almost done. I'm trying to share this live, guys. Please just a minute. Um, a minute, guys. Let me just. Okay. Okay. Now, hi, Frankie. Thank you so much. Thank you so much. I appreciate you for being here. So, now, as we were saying before I took that time out, now the thing is, if for you to find out that you have an oily skin, there are ways to do that. First off, you just when you wake up in the morning, you get your mirror and you look at your face. Once you find out that you have oils distributed around your face, then you have an oily skin. Okay, it's as simple as that. Now, if it's what if that is still confusing for you, there's another way you can find out. I'm just giving a brief recap of what is on my video, on my page, on my channel. So if you want to really get detailed explanation to this, then you go watch one of the videos I posted about last week about skin type, how to know your skin type. Now, the second way you can find out is you first off whenever the morning, afternoon, whenever you want to do this, you can. Not in the morning. Now, when you get a mild cleanser without actives, a mild cleanser, and then you clean your face. Well, after cleaning your face, you allow it sit in, like, to dry in, okay? And then you wait for about 30 to 1 hour. After that, when you get a mirror, then you touch your face and it feels oily all around your face, not just the T-zone, because the difference between a combination skin and an oily skin is that a combination skin has oils distributed on the T-zone area, just the T-zone area. When we're talking about the T-zone area, I mean your forehead, here, and for some people on their chin. So if you have oils just distributed on those areas, please, you have a combination skin. This lecture, this skincare routine I'm bringing up to you now, bringing up here now, isn't for you. I'm talking to those people who have oils distributed all around their face, like even on the lateral part of your cheek. If you touch it, you feel like it's oily. In fact, you can even see some people, you see the oils on their face, you can use it to fry egg. It's as obvious as that. So if you have oils distributed all around your face, then you have an oily skin. Okay, and I know how difficult it is to get skincare products that will actually fit into your skin routine, that will not even, you don't even react badly to, or would even work for you effectively. Okay, so guys, for those who are just joining this life, our life is all about skincare routine for oily skin. Those who have an oily skin type, this will be very beneficial for you. Even if you don't, you can still listen, and then it gives you more clarity to even to the products you're using in your house. You know if you actually need them or you don't. Now, I have my book here, so I'll be reading out some points, just using it as a guide to what I'm going to discuss today. The next thing is the merit of having an oily skin, the advantages of having an oily skin. Now we've talked about oily skin. There's an advantage. Okay. So now, if your body produces excessive oils, it's as simple as that. It moisturizes. It gives you good moisture, like moisture to your skin. It moisturizes your skin. It keeps your skin moisturized. Okay. So those who have oily skin are always, oh god, their skin um barrier is top notch. Okay, they're actually always moisturized. And one one other advantage of having an oily skin is that it's they actually don't get they have this anti-aging, how will I put it, they don't get old easily, right? that's that's basically the easiest way to say it. They have anti-aging properties. Okay, your body is always moisturized. You don't have wrinkles, you don't have all those fine lines. You are you don't age fast. That's one of the good things, the good sides of having an oily skin. Okay, so it also, those who have oily skin also have good amount of vitamin E, production of vitamin E. Okay, and vitamin E is an antioxidant. We all know what I don't know if we all know, but I'll explain this. Antioxidants are like, for me, I like to call them the soldiers our body needs. Soldiers in the sense that they help mop, like, mop up, what's it called, free radicals that would cause cell damage. I don't know if I'm speaking some terms that you don't understand, but simply put, They are very essential for good cell turnover. Okay, your skin is like your body in general is top notch. Okay, so it's very, very important there. There are the advantages of the what's it called, the skin, the oily skin, all of these I've said. Unlike the dry skin, they don't have to battle with flakiness, itching, and all of that. They are always moisturized. Now, we've talked about the advantages, then the disadvantages. You see, when I talked about having excessive oils that would moisturize the skin, excessive oils, you see that excess oil, it causes problem. Now, when you produce excessive oils, it just causes clogged pores. Yeah, your body, you have clogged pores, and it leads us to the next disadvantage, which is acne breakouts, blackheads, whiteheads, and all of those blemishes you have. So you see, there's the advantage there, but there's disadvantage too, and disadvantages are so much. Now, acne breakouts because of the clog pores, simply put, because of the clog pores. Now, your body is producing these oils and they are just stuck like underneath the skin. Okay, it's it's actually a process, like a gradual stage, like clog pores, accumulation of the sebum, that's the oil, all of that, then inflammation process goes on, and then you see this. That's just what acne are. Your body is not pushing out this um waste that is producing, is not pushing it out because the pores, those holes, those tiny holes are covered. Okay, so mm, for another disadvantage for those who have an oily skin is that for those my girlies who make up now, your makeup cannot stay. It's as simple as that. I know I've heard people say, huh, I have an oily skin. That's why I don't really like to make up because if I walk from here to here, my makeup is all over my face, like it's dripping down my face. Yeah, the body is producing excessive oil and it's just pushing it down. It's just pushing it down. So, guys, after we've said all these things, I'm going to go into the, what this life is all about, the skincare routine that suits an oily skin, the skincare routine that suits an oily skin. Now, for me, I love to group it into two major things, which are the cleaning stage and the treatment stage. Okay. Now, the cleaning stage and treatment stage, I need you to pay attention because it's um it gets really interesting from here. Okay. So for the cleaning stage, it's divided into two. We have the cleansers and the toners in it. Because why I like to put them together is because the cleansers do the same thing as the toners, truthfully. Cleansers do the same thing as the toners. Okay? Just that most times is actually good because sometimes your toner can contain an extra thing that your cleanser doesn't have. Okay, that's why it's important to also have a toner. Not like important, but necessary sometimes to have. Okay, depending on your peculiar skincare problem, your skin problem, sorry. So, guys, the first one we're talking about is the cleansing. If you have an oily skin, the first step to your skincare routine is cleansing. In fact, that is the most important step. The most important step is cleansing. Because from what I've explained now, your body is producing oils that are clogging your pores. What I mean by clogging, I mean blocking your pores. If you don't cleanse, as in if you don't like remove those clogs, those covering and everything, there is no skincare product that you will use that will work for your face, that will work for your body. It's not possible. So the first important, most important step is the cleansing. And like I said, the cleansing, the, for me, I divided it into the cleansers and the toners. Okay. Now, for the cleansers, I'll talk about the cleansing method. Okay. The cleansing, and then the second one I said was the treatment, right? Now, let's start with the cleansing. For the cleansing, the first step, like I said, is the cleanser and the toners, right? The cleansing. Now, first thing to do is to cleanse your face. you're going to get a cleanser. I don't know if I should explain that, but we have different types of cleansers, and I'm not going into that. But I'm going to explain to you what and what you're going to do. Now, for me, if I'm to advise you guys that have oily skin, you should get two cleansers. Okay, first off, let me not even rush you. There's this thing we call double cleansing. Like is whenever something starts trending, everybody is saying it. People don't even understand what it means. Now let me just explain that to you. When someone says to you, I double cleanse, it means the person uses two cleansers, one oil based and one water based. Okay. So now the importance of this is that okay, this person either makes up, does makeup, and the water based won't take off the makeup properly, completely. So she has to use two, or he has to use two. Now, for those who have an oily skin, you see the same thing that person who does makeup does. That's what you do. You have to get two cleansers. You can use one, but for very effective effect, like effective results, sorry, you have to get two cleansers. Now, that cleanser you're getting is one is going to be an oil-based cleanser. The second will be a water-based cleanser. Let me tell you how you use it. The first thing you do is to use the oil-based cleanser. You're using that one because you want to clean off maybe the makeup or some superficial debris on your face or dirt or anything, you understand, just to take it out first. After that, you're going to go in with your water-based cleanser. Okay, your water-based cleanser now does a deeper cleansing. It goes in and then clears the pores properly. Okay, let's just put it like this. The oil-based cleanser does a more superficial work, while the the water-based cleanser, sorry, does a deeper work. So you see the importance of it. Now, someone who has a dry skin, you have no business in double cleansing. If you're if you come across this video, please, and you are using two cleansers and you have a dry skin, you're sure you have a dry skin, or even a combination skin. I don't really think a combination skin needs that. Just need a one good cleanser and you're good to go. But if you have a dry skin, you have no business in double cleansing because you're just even going further to strip more. We are trying to get in moisture and you're taking out the ones that the body is managing to get. It's just as simple as that. So you have no business in doing that. Now, I wrote down some oil-based cleanser that I feel would actually be good. Okay, we have the CeraVe Hydrating Foaming Oil Cleanser. We have the Biosense Squalane Oil. I don't know if I'm pronouncing it well. Then the Ordinary and the Medix 8. Okay, so if you get that one, those ones, any of these, and you use it first, the second thing you're going to do is to go in with your water-based. Personally, I use the Cosrx low pH good morning gel, and it does perfectly well for me. I'm not an oily skin, but I use that and it's okay. Now you can use that one too in together with the oil based. You can also use the Cosrx Salicylic Dental Cleanser. I'm not doing an advert for anybody, but I'm just telling you that in case you're confused, in case you go and walk into a store and you're not even sure, nobody's around to like tell you this is oil based or it's not clearly written there, then you can go for this product. Now, when you're done cleansing, okay, then our next step is to use our toners. Now, you see for toners, some people will say toners are not really effective, they're just extras and all of that. I understand that too. But you see, for those who have oily skin, I really think toners are very like is a must for you guys. A must that you have a toner, an effective toner, like a toner with actives in it, good actives, depending on your peculiar skincare problem. So now, the next thing you're going to do is to go in with a toner. Listen, you should know on no account use an alcohol-based toner. Use a toner that is alcohol-free. Very, very important. Now, there is this thing. If you type on Google, it tell you, some will tell you alcohol-based toners are not bad. They also help to mop up whatever, whatever. I don't think so. For me, I would actually advise that you stay away from alcohol-based toners. Just get toners that are alcohol-free. Why? Because toners that have alcohol in them, studies have shown that they could actually worsen acne. For those people that have acne prone skin, imagine using a toner that has alcohol in it and they said alcohol worsens it. It's going to worsen your acne. So you see, it's better. The merits are better. Like, just stay away from it. Get toners that are not, that don't contain alcohol at all. Okay. So the thing is, if you, I think the spirits and the rest how have alcohol in it. Imagine them putting them on your body. They feel hot and all of that. Okay, it further goes to strip off the barrier your body managed to get. You understand? So you don't need it. You don't need it at all. Now, hold on, guys. Give me a minute. Sorry, guys. I had to sort something out. So, guys, the thing now is that do not use an alcoholic toner, like I said. Just get a toner that doesn't have any alcohol in it. Okay, I don't think, not like I don't think, you do not need it at all. Okay, so it's advised, if you want to get a toner, hmm, it's advised you get a toner that contains either of these products, or maybe two, maybe a product that contains two of it, or one of these things I'm going to list out now: salicylic acid, glycolic acid, or lactic acid. Salicylic acid, glycolic acid, or lactic acid. You know why I love salicylic acid a lot? Ah, you see, salicylic acid and oil, they are like this. Salicylic acid loves oils a lot. Now imagine using a product that contains salicylic acid. It's just going to go there and mop up the oil, that excess oil that you have is going to eat it up. So it's very advisable that when you're getting a toner, as someone who has a an oily skin, confirmed oily skin, you get salicylic acid. Incorporate salicylic acid into your skincare routine, and you see the difference. Okay, even I think combinations, yeah, you can combination skin, but you have to, for those who use, those who have oily skin, use salicylic acid like almost every day. You that has combination skin will have to use it like twice a week, once a week, not like every night you are rubbing and scrubbing your face with salicylic acid. You're going to get irritations from it. Okay, so salicylic acid. Now, step two is the treatment, like I said. And this step two is peculiar for individuals, like different individuals and their problems. This first step of cleansing and toning, as toners, use of toners, is a general rule for everybody who has what's it called, an oily skin. Now, if you come to me with an oily skin and you have acne on your face, the treatment I'm going to give you is different from someone who comes to me with hyperpigmentation. You have an oily skin and you have hyperpigmentation. That I will need you to pay attention to this step. So not everything I say here you're going to do, because you have to look at your skin and understand if this step is for me or if it's not for me. So treatment step is peculiar for different skin care problems. I have an oily skin, yes, and I have acne, different treatment. I have an oily skin, yes, and I have irritations on my face, different skincare, different skincare, what's it called? skin treatment, sorry. I have an oily skin and I have blemishes, different treatments. Okay. So I'm just going to give you like a rundown of what and what to you can get from each for each of them. Now, this depends on your specific skincare concerns, like I said. For acne prone um oily skin, you have oily skin, or you have not acne acne like active acne, you already have acne on your face as an oily skin person. After you've done your cleansing, your use of toner, as in your toners, the next thing you're going to be doing is to use a product that will take, as in like clear, what's it called, the acne that are already full blown that you can see. And then the products that you can use are like products containing benzoyl peroxide, retinol. These products are wonderful. Now, for retinol, it is advisable that you meet a medical esthetician, a dermatologist, to prescribe that for you. We have over-the-counter creams, retinol creams that are actually good. But if you try out those retinol creams and they don't work, there are orals you can take. But those orals are should strictly be given to you by a certified medical personnel. Okay, because it's there are so many things attached to it. It can be teratogenic. What I mean by teratogenic is that you can take in those what's it called? Isotretinoin, that is the retinol, the oral ones. You can take in those ones, and it could actually affect, if you're a woman, if you're pregnant, you could actually cause a malformation for your baby. So you see how important it is not to walk into the pharmacy store and get any drug you want to get because you feel like you have acne. Imagine taking isotretinoin and then getting pregnant and having a baby with a malformed baby. It's painful, right? Yeah. So you see how important it is. If you try out retinol or topical retinols and they do not work for you, please make sure, just walk into a, a dermatologist's office or meet a medical esthetician to give you the follow up, to give you the proper treatment, the proper assessment, proper assessment before they commence isotretinoin on you. For some people, for if it's for me to even advise, I will tell you not to even start the retinol. Sorry, guys, retinol. Let's You have to get it from a dermatologist or a certified medical esthetician, or you get a trained personnel that is trained to give these drugs, trained to do this. Okay, so it's very, very important. Now, I hope you understood to this point, because if you did, then yeah, don't mind me, guys. So acne prone, benzoyl peroxide, or retinol. Moving further, we have for those that have hyperpigmentation. Thank you, Tati. Thank you so much. Thank you for being here. Those that have hyperpigmentation, what you can use after you've done your cleansing and use of your toner, the next thing you can, if you are tackling what's it called, hyperpigmentation as an oily skin person, then you should use a product that contains niacinamide or vitamin C, or the both of them. One beautiful thing is that you see niacinamide and vitamin C, they are besties. Perfect. When you combine the two of them together, they give excellent results. So, as one who has an oily skin and hyperpigmentation, what I mean by that is you have, how will I put it now, darkening, or you feel like your forehead is darker than your face. You have darkening here and all of that. That's hyperpigmentation. Okay, hypo is like lightning, so hyper higher, more. So if you have an oily skin and you're battling with hyperpigmentation, then you should get a product alongside these cleansers I've mentioned and the toner I've mentioned. You should also get a either a serum or a cream, whatever it is, that contains niacinamide and vitamin C, or vitamin C, niacinamide or vitamin C. Okay, they are good with clearing hyperpigmentation. Now, for if you have skin irritations, I mean, what I mean by skin irritation is that you have redness somewhere, like you feel like you wake up in the morning and your face is red, reactions, you're itching all around, you get flaky, not flakiness, but like your face is scratching you. That's just what I mean. Your face is itching, your face is red, then you should, alongside all these things I've mentioned, get a cream that contains hydrocortisone. Okay? Hydrocortisone is antisteroid, a steroidal, sorry, that would bring down inflammatory process. It's just an inflammatory process. Okay, it's a steroid, sorry, that will bring down an inflammatory process going on your face. So for those that have wrinkles, you have oily skin and you feel like your face is wrinkled. I don't even know how they even feel like their faces are wrinkled. But you feel like your face is wrinkled or you have fine lines. I wish I could share pictures here to show you guys what fine lines actually mean. You see those old women that when you look closely and you see they have tiny, tiny lines like this, tiny, tiny, fine lines on their faces. Like you have to look very close. Yeah, and then wrinkles. One beautiful thing that can take it out is retinol. Okay, retinol is actually wonderful. Yeah, so you can also get that if you feel like you have wrinkles on your face or you have fine lines on your face. Okay, so now I'm going to group this in for easier understanding. I am going to group this into the morning, what you should do in the morning and what you should do in the night, step by step. I'm giving you all the whole lecture of details. Now I'm going to put it to you, explain to you the better way for you to understand it. Okay, step by step, better way for you to understand it. Now, as an oily skin person, morning routine, your morning routine should be like this. First, you do your cleansing. Okay, double cleansing. Like I said, I love double cleansing for oily skin type because, like I've explained in the beginning, all I do chatting, my sister. Thank you so much for being here. I'm so grateful. Thank you for the comment. Thank you for the like. Thank you so much. Now, for back to what we're saying. So, guys, for the morning routine, for those who have an oily skin, the first thing you're going to do is your cleansing, like I said, the cleansing, and that is the double cleansing. You clean, you do your first cleansing with an oil based cleanser. The second cleansing with a water based cleanser. Because why you need that oil based, I'm going to say it again for those who are just joining. Why you need that oil based cleanser is because you want to take off the superficial debts that you're seeing, those ones that are just superficial. Okay, you want to take them out. Now, why you need the you're going in with the water based is because you want to now go deeper to take in those ones on the crevices, all those ones deeper in your pores. You want to take them out. So you see why it's important to have two cleansers as someone who has an oil based skin. Okay, an oil skin type. Sorry. So you use you double cleanse first. After double cleansing, you're going to go in with your toner, like we said. And that toner should contain either of these three products, either of these three compounds. That's just it. Compounds, sorry. We have the salicylic acid, glycolic acid, or lactic acid. You see these three. There are other ones, but these three are like wonderful. So just get products that contain either of these three. A product can contain salicylic acid and glycolic acid, can contain lactic acid and salicylic, you get salicylic acid. So any one that you see that you feel like you want to try out is going to be excellent for you. So you're going to get a toner that contains either of these three, or two of it, or one, anyone. Okay. Then the third step is to apply whatever specific treatment, the cream that you need. Now, what I mean is, like we said, the treatment plan. Now, you have gotten your cleansers and you've double cleansed. You have gotten your toners and you've used it that contains salicylic acid, glycolic acid, and lactic acid. The next thing is to look at your skin and you're like, okay, I have an oily skin, Do I have acne? Now, this oily skin now, am I seeing acne on my face? Then you know the next thing you're going to buy is what? The benzoyl peroxide. That's what you're going to get. You get the benzoyl peroxide alongside these things you're using. If you look at your skin and you feel like, oh, I feel like God, either you get benzoyl peroxide or you get retinol, like I said, or you look at your skin and you feel like, yeah, I don't know. I think that this my face safe. I think I have wrinkles and I have fine lines, or I feel like I'm aging faster. Ah, like you get a retinol, a cream that contains retinol. Okay, that's what you're going to do. Or you have this oily skin, and then you feel like, okay, my face is red. Hydrocortisone cream. That's what you're going to get. Hydrocortisone. Hyperpigmentation, you get niacinamide or vitamin C, or niacinamide, like a serum that contains niacinamide and vitamin C. Now, there's something I want to explain to you before I might forget to mention this. I have to mention it now. Once you've used a product that contains salicylic acid, you are advised to wait for like 30 minutes after you've applied you use it first. Then you will now wait. After 30 minutes, salicylic acid would have settled in into your skin before you apply another active. It's very important to do that. It's very, very important to do that. So you have to wait for it to settle in for like 30 minutes before you apply your benzoyl peroxide if you are battling with acne or retinol or whatever it is. You have to wait for 30 minutes. Okay, so that's what you're going to do. Now, after you've done your cleansing, you've used your toner, you've applied whatever specific treatment that you want, like I said, the benzoyl peroxide, the retinol, the niacinamide, vitamin C, and all of that. The next thing to do is apply a lightweight cream. Lightweight cream. Children of God, you have no business with shea butter. I'm telling you from a place of love. You have no business with shea butter. You have no business with Vaseline. Vaseline is very heavyweight. Like, in fact, apply Vaseline. It clogs the pores. So you don't need it. You don't need Vaseline. You don't need. You have no business with those. The two of them. You have no business with it. You have no business with it. So you have to get a lightweight moisturizer, a lightweight cream, lightweight moisturizer. Now there's this one I use. I use a snail mucin. It's a moisturizer, and it's lightweight. It just settles in, glides in into your skin, and then it's absorbed. Okay, it's lightweight. Why you don't need something that is not lightweight is because, like we said, we are trying to save your pores. We are trying to unclog your pores. If you apply something that has so much weight, like what's that term? Or something that is thick and very greasy on your face, it's going to clog your pores. As simple as that. It's going to clog your pores. Okay. So you just have to avoid anything that has to do with. You see shea butter, you have no business with it. You see vaccine, like I said, you have no business with it. Whatever benefit, they have beautiful benefits, but as an oily skin person, you do not need them. Your body is already producing enough oil that even that shea butter, you don't need them. It's too much extra for you. Okay, so you have to apply that. The last step now, after applying, like I was saying, okay, I said something. I use this snail mucin. I don't know if you can get that. It's very nice. Snail mucin, the Cosrx snail mucin is really nice. There are other ones. There's even this other Korean products that make, but as an oily skin, you can apply that. It's very lightweight, and it's perfect. Okay. So the last step is to use an SPF, a sunscreen, a sunscreen. You see this sunscreen? Even me, I also default. Like I also fault Abby. I don't know. But even me, sunscreen is actually war for me. But it's very important. Funny enough, you see sunscreen. Sunscreen even helps with hyperpigmentation, but we don't know because it helps really, and I made testimonies to that. It helps with hyperpigmentation, but that's the lecture for another day. Okay, it's the lecture for another day. I'll be explaining to you later the time how it helps and how you should get a good sunscreen that works for you, because there are so many sunscreen that as an oily person you should not use, as a combination skin you should use or you should not use, as a person with dry skin you should not use. So it's also something you should also pay attention to. There's this biove, but I don't know if I'm pronouncing it correctly. That has this blue thing and white container. My sister always do that, we use it together, so she would know. And but that one isn't good for someone who has an oily skin, because it's, God, if after applying it, you see the oils all over your face. Okay, so that's it. Then for the night routine, okay, let me recap the morning routine again. Okay, because I digressed a little. Morning routine, these are the steps. First, cleansing, double cleansing. In the double cleansing, we mean oil based and water based. After that, we're going to use a toner. The toner, we're going to use a toner that contains salicylic acid, lactic acid, salicylic acid or lactic acid, or glycolic acid. Now, there's something I didn't explain to you. This glycolic acid, salicylic acid, all these acids that I've been calling here, they are all exfoliants. Exfoliants, what I mean by exfoliants are you're finished cleansing your face. You're not using salicylic acid to take off the debris from your face. Understand? Like your, it's not a mechanic, it's a mechanical way of, I don't know, I can't remember, but it takes it off. You understand? So they're exfoliants. You don't need to start scrubbing your face. All these people that go to stores and they show you special scrubs. After you've used salicylic acid, it does the same work as that special scrub that has those little, I don't know if it's salt or whatever they even say they put in those things that you use to scrub your face. Salicylic acid does the same work, sorry, not exact same, the same work as those scrubs. Lactic acid does the same, and glycolic, there are a lot of them, even mandelic acid, azelaic acid, and all of that, they do that. But these three are perfect for someone who has an oily skin. I digressed again, sorry guys. So from beginning, cleansing, the cleansing, oil-based and water-based cleansers, that is double cleansing. Second one, a toner. Use a toner that contains either of these three I said: salicylic acid, glycolic acid, or lactic acid. Then number three, you do specific treatment. If you have acne, then you know you are treating for acne. After that, you buy a product that contains benzoyl peroxide or retinol, or you also get, you can even use two of them together, but that's a story for another day. Then you get or if you're battling with, what's it called, hyperpigmentation, you get niacinamide, vitamin C, and all of that. Then if you're battling with wrinkles, retinol. You're battling with what's the other one I didn't mention? Just them. And then the next step is using a lightweight cream to seal everything up and to give your body enough moisture, because you have really scrubbed and done a lot of work on the face. Okay. Then the next one to do is to apply your sunscreen. Now, for the night routine now, it's basically the same thing, but there's a little change somewhere. Now you still do the cleansing in the night, your double cleansing. You see, as an oily skin person, you must do your double cleansing morning and night. Somebody said you should do it in the night and leave it in the morning. You do it in the morning and you will do it in the night, because your body is on a constant mode of producing excessive sebum, excessive oils. Okay, so you will do it morning and you will do it night. And I did not tell you to do it in the afternoon. Please leave that face. I did not ask you to do it in the afternoon. I said you should do it in the morning and in the night. Okay. Now we're going to double cleanse. One, use your toner as usual. Two, apply now the treatment again. Apply your retinol. Oh, there's something I skipped. Sorry. For morning, please, morning routine, guys, please. You have no business applying retinol unless you know you want to bath yourself with SPF and wear cap and maybe umbrella and walk under a canopy, if that makes sense. Because retinol and sun, don't do that. Okay. So if you have retinol in your routine, please, it's advisable that you use it only at night. It's that before you start battling with hyperpigmentation that you did not bargain for. It is very it is not contraindicated though, but please, for your own safety and for your peace of mind, just use retinol in the night. Okay. use it in the night. You can use your benzoyl peroxide in the morning, use your retinol in the night. Okay? You can use your niacinamide in the morning. Vitamin C, I wouldn't advise to use it in the morning. I prefer you use vitamin C in the night because of its reaction with sunlight. I prefer you use it in the night. But some people still use it in the morning. So whichever one that works for you, whichever that rocks, whatever rocks your boat, sorry, you do. So you can use it, use benzoyl peroxide in the mornings. If you have benzoyl peroxide and retinol in your routine, use benzoyl peroxide in the morning, use retinol in the night. Don't use two of them together. Biko. Don't mix, kota, cha. Don't do that. Don't use two of them in the morning, please. Me, Dr. Wendy, is begging you. Please don't use it together, okay? So after that, you just as do your normal treatment routine. Next thing is to apply your lightweight cream and your SPF in the night. In the night, I'm sure some people will be like, Are you sure?" They told us that we should be applying our sunscreen every 2 hours. That's the way to apply. I hope you guys know that is every 2 hours I apply sunscreen. Eh, even me that is teaching you, I don't even apply it two times, 2 hours, 2 hourly. Eh, but I'm going to tell you what is right. If you can apply it every 2 hours, perfect. You are not going to have problems with hyperpigmentation. But if you cannot, you try and be going about with umbrella because this Nigerian sun is very, very hot. Very, 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 very hot. Now, things to avoid if you have an oily skin. Things to avoid if you have an oily skin. Things to avoid if you have an oily skin. Do not get your pen and your paper. Today I'm your teacher and you do as I said. So my get your pen and your paper. Do not keep cleansing. I know I said it before. You don't have any business with anybody telling you you're not supposed to cleanse. In fact, hey, Obegeli, you have over cleansed this your face. You are going to cleanse that face because why? Your body is on a constant, it doesn't have any break, a constant mode of producing oils. So the only time you're not going to be cleansing is in the afternoon. I beg God, I use God and beg you, sorry. Not like it's contradicted, but if you cleanse in the morning, you have no business cleansing in the afternoon and then cleansing in the night. You just strip off the oils, the natural oils on your face. Like you do an excess work and then you be tilted over to the other side, you start battling with skin barrier problems. Okay, so do not skip cleansing. Do not skip cleansing. The next one is choosing the wrong products. Choosing the wrong products. You see people that have oily skin and choosing nonsense products, they're like this. They have a way of choosing rubbish, and I don't know. If you have an oily skin, you have to really pay attention. If you're just joining this live, please, thank you so much for joining this live. Thank you so much. I'm so grateful that you're here. You can as well go back to the beginning of this lecture to know why I'm hammering why you should not use the wrong products. Now, avoid any product that has alcohol in it. I'm going to hammer this over and over again. You cannot have all your beautiful skincare products and then you have a toner that has alcohol inside it or a cleanser that does. So go and review all your products now. You have all this skin and your acne is boom, 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 boom. And you're wondering why I bought everything my dermatologist said I should buy, but you bought one that they did not ask you to buy. You have to go and check, review, and then pick that one out and mouth wear. Okay. So you use that, you're going to desist from using any product that contains alcohol because it can also increase the amount of secretion of sebum, the amount of oil secretion to the worsen your matter. Now, avoid, I've said this before, but I want to hammer it again. Avoid any thick or greasy product that contains, sorry, what am I even saying? Avoid any product that is greasy or thick, like a cream whatever it is, don't apply it on your face. You're going to be blocking and clogging your pores. Okay? Cocoa butter, shea butter, Vaseline, Okoma, Okome, what's that thing called? Yeah. Avoid them. It's not made for you. Do you understand? Just take a chill pill. You mustn't use it. Just desist from using it. Remove your mind from it. It's not part of what God sent you to do. Eh. So you're not going to use it. Do not skip your sunscreen. Now, let me explain to you why, as an oily skin, that's why I decided to write this thing down, because I know that if I should say, just like say it like that, I will forget a lot of things. I won't bring my points together. It's good as I wrote this thing down. Now, an important point is that as someone who has an oily skin, hmm, there is an increased chance of tanning. Tanning means having hyperpigmentation due to sunlight. That's just the simplest description I can give it. Okay, tanning. You see those white people that you see that always go to. Even though they say they go to the beach to lie down and then tan. Here we want to take off the tan. You understand? So you have no business not using your sunscreen, because there's an increased chance of you tanning. Now imagine not using your sunscreen and you have oily skin. You're going to start battling. That's why most people that have oily skin have hyperpigmentation. It's as simple as that. As simple as that, sorry. As simple as ABC. That is why they have problems with their with hyperpigmentation. You see them with oily skins, and you see their forehead is dark. They have acne, and then they have hyperpigmentations in between. Yet it's actually the increased production of melanin due to sunlight. Okay, your body. And as Africans, I would say this: we're actually blessed. No this to anybody, but as Africans, we are blessed because we have more melanin production in our body. Like our body produces more melanin than every other race. Now we don't have to battle with skin cancers. Melanin, the melanin you have is good. It protects you from skin cancer. That's why people that bleach, they will bleach and tilt to skin cancer. Yeah, because you are killing the melanocytes that God gave you. So that's why it's not good to bleach, because you are killing them. Artificial obubu, you are killing those cells. Hmm? That's why, that's how, okay, I know Africa, we go through a lot, but at least the fact that we produce enough melanin is one good thing that we have. We don't have to battle with skin cancers. We don't have to, be looking for where to tan so that our body can just decide to produce melanin to protect us from skin cancer. No, we don't have to battle with that. We naturally, you know, we naturally produce um, melanocytes, melanin, that protects our body from the UV rays. Okay, that would gradually result to someone having skin cancers. So you see, one thing about skin is understanding the basics. If you understand the basics of what your problem is, then it's very easy for you to treat. Very, very easy. For some people, I know if you get benzoyl peroxide and retinol and it doesn't work for you, is it you're not using it well or you bought the fake? I will tell you the truth. Either you bought the fake or you're not using it correctly. Okay. And for the sake of this video and for the sake of clarity, make sure that retinol that you're using was given to you by a dermatologist, someone who is certified, or a medical esthetician who knows what he or she is doing. I did not say you should go to Wena Kotancha somewhere and tell the person that you want to remove retinol, and the person will not give you. No. And again, from a place of love, retinol causes um is teratogenic. So you have to be sure of what you're putting in your body that will go into your bloodstream and cause havoc when you shouldn't have. So if you're going to take isotretinoin, which is retinol, orally, then you must get your clearance, a certified, like a written go ahead from a dermatologist or a clinic, a medical institution, or a certified physician. Anyone. So you see, those who have oily skin, it's not so hard. It's not hard because every single day they're always in on the internet crying and shouting that they have oily skin, they have acne, they have this, and it's not going. No product is working. No, 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 no. It's not every product that you see that you use. It's not every product that you will use. In fact, not every product work for you. That's one thing you should know. I can get a Cosrx. I can be using a Cosrx Good Morning low pH gel. I don't know if I pronounced that correctly. Another person will be using what's the other one? Clayton's, whatever. It might not work for me. You understand? It might not work for me, but the next person will use that same product and it will work for her, him or her. The thing is that you keep trying out this product. If you're lucky enough, you try out the first one and it works for you stick with it. Not when you try out one and it works for you fly and go look for another one. You try out that one, you stick with that one that you have. You can decide to add something extra to it, but you stick with the one you have. Okay? So it's not every product that you get that will work for you. Just is a the thing about skin is that it's a patience, is a journey of patience, a journey of love. But with all these things I've said today, if you joined from the beginning, then you're very, very lucky. But if you are joining now, you're still lucky because you can still go back and still watch this video. It's still on my page. It's going to be here for a very, very long time. So you can go back and watch from the beginning, from the introduction. I explained in details what this oily skin is all about, the merits of having an oily skin, the demerits of having an oily skin, things you should avoid as a person who has an oily skin, advices that you shouldn't take from Umuna as a person who has an oily skin. You understand? And then the next thing I talked about was the skincare routine, step by step, what you should do. I even went on to explain the, like, call out some products that you can do in my hey, Jesus, in my magnum, hey, Jesus, you guys understand, but in my good heart, I decided to list out some products that will actually work for you. Okay, some products that you can actually decide to try out and then come back to give me review because knowledge like this, maybe my mind doesn't come like that. Okay, so you can decide to try it out and if it works for you, beautiful. Okay, so after we went on to talk about that, and now we are where we are. So, guys, I hope with this, all these my lectures, you now understand that. You don't understand first that whether you have an oily skin or you don't have. Because some people will come and meet me and tell me, I have an oily skin. My skin, you're looking at this person's skin, and this person's skin is as dry as God knows what. And you're asking the person, who told you that you have an oily skin? And the person is telling me, I have an oily skin. I know that I have an oily skin. And they keep on using the wrong product. So before you start your skincare journey, the first thing you should know, like I said in my video, I have it on my channel. Do well to go and watch it on skincare types, how to know your skincare, sorry, your skin types, sorry. Go and watch that video. You to give you a clearer picture of what I'm saying. The first step to getting a good skincare result, a good result from your skin is to know what your skin is. Is my skin oily? Is my skin dry? Is this my skin sensitive? Is this my skin, what's the other one, normal? Okay, now, and I said in that video that you can have an oily skin and a sensitive skin. You can have a combination skin and a sensitive skin. You can also have a dry skin and a sensitive, but you cannot have a normal skin. Your normal skin is your normal skin. Normal skins are the babies of the house. You just have the perfect kind of skin, perfect secretion, perfect texture, beautiful tone. You get, it's just like that. So if you watch that video, you understand why you should start from there. Not just walking into a cosmetic store and telling them, people, my face looks like this, I have this big bump here. What do you think I should take? And someone who just learned from Nkechi will tell you to go and use, what's that thing they always use? Whatever they use on your face, and then you start reacting, and then it kills your skin barrier, and then you go back, come down with so much more problems that you didn't even bargain for. But if you're certain that I am a combination skin, I'm going to go into the store and I'm going to get this. And it should definitely work for me. And if it doesn't work, then it has to do with the product. I just have to switch products. Or I have an oily skin. The first thing I have to do is to actually get a good cleanser. Let me get a good cleanser. Okay. Dr. Wendy said I should get a cleanser that has oils and one that has um water. That is one that is oil based and one that is water based. Let me do it like that. Then I'll first use the oil based and then go in with the water based. Let me try that first for the next 2 weeks. Let's see how it goes. 1 month. 1 month is better because it takes your skin 28 days to like rejuvenate. If you're using a good skincare product, in the next 28 days, that's when you start seeing results. This is from skincare creams or whatever that you buy that they'll tell you 3 days you whiten, run. If you're running, you dust your slippers and fly, not even run. Because those things, if you tell you what the mercury that is inside that product will shut down your kidney in 2 years. The mercury. So if you're getting a skin a cream or a product that you want to work for you, calm down, wear your armor of patience and wait for 1 month to 6 weeks before you can get results, because before you should see visible like despicable results that now you know that you're really really changing, it's really working for you. But if you wake up under 2 days you rubbed one or sharp pepper cream and you're white, then there's a problem. No, something is in that thing that shouldn't be inside it and that shouldn't go into your body, because the body doesn't work that way. It takes 28 days to 30 days for turnover to come. And when the turnover comes, new cells, okay, are coming. And that's when you should see results. So if you do these steps like this, there is no how. After you've gotten the cleanser, then you say, okay, I can get a toner. Let me get a toner too and do this. I'm going to get a toner that let it contain salicylic acid or lactic acid or what's the other one? Glycolic acid. You walk into a store and they give you toners and you're like, what does this contain? You self you see it. What does it contain? If it contains salicylic acid, I think this is going to be good for me. It contains lactic acid. Yeah, it contains glycolic. Yes, it's going to be good for me. And one thing you should know about salicylic acid that you can actually have irritations from it. So the best way to start using salicylic acid is once a week, twice a week, thrice a week. I don't know if you understand what I mean. You bought it this week, you're going to use it once a week. I bought it on Monday, for example. I'm going to use it on that Monday. The next week, I'm going to use on Monday and on Thursday. The third week, I'm going to use on Monday, Wednesday, and Saturday. Gradually. You don't just bombard your body with salicylic acid morning, afternoon, night. You're going to have irritation from it. So you gradually introduce salicylic acid into your system, or else you're going to react to it. And some people push it. If you like, do come do it in step like that. Some people just have the normal reaction of purging. It's called purging. They rub salicylic acid, sorry, and you start seeing acne and all of that all over their face. They are purging. The salicylic acid is pushing out those debris to the surface of your skin. If you're patient enough, next 6 weeks to 2 months, it will clear off. For some people are not patient, but if it clears off, you see wonderful results on your face. So you see, skincare is about patience, but first, before patience, is about knowing what you should use. So when you get those products, you know you've gotten settled with your toners. Then you now look, pay attention to your skin and be like, okay, this is my skin now. What do I have that I don't think is normal? Okay, I have acne here. Like there's so many here. Or I have what's that called? Blackheads, whiteheads. You get, I have hyperpigmentation here and all of that. I think I need to treat this too. That's when you now start paying attention to those details, and then you now start thinking of getting retinols or benzoyl peroxide and all of that, and niacinamide, vitamin C. That's when you start paying attention to those ones and wanting to get those things. You don't just wake up in the morning, dear brothers and sisters, and fly to go and buy retinol. No, retinol will work in a skin that is prepped. You've done these stages. Yeah. You cannot get retinol and then use it on your face. And that's when it's going to work. You cannot just fly to the market and go and buy it and start using it and you expect the results to come. No. I know a lot of people that will be, especially where they sell creams and you walk in and you're like, "Eh, this acne on my face is so much." Someone from nowhere will just tell you, hey, please buy this. You see this benzo peroxide, it work for you. The first question to ask that person is, what do you use? How do you cleanse your face? What products do you use? What No, the first question is what skin type are you? Sorry. The person tells you the skin type he or she is, then you tell the person, ask the person the next question. Who told you that? Or how did you find out that you're this skin type? The person tells you how. The next question is, how do you cleanse your face? What is your skincare routine like? What are the products you use? What toner are you using? Okay, okay, you're using a good toner, you're using a good cleanser. I think I have something that will help you. Let's go over to getting benzoyl peroxide. Okay, let's try it out. And if you feel like it's not working so well, I'm going to add in something else for you. That is how to do it. You don't just fly from nowhere. And just because Dr. Wendy said, benzoyl peroxide is the best thing that you can ever do, you run to your nearest vendor and tell the person, do you have like 3 cartons of benzoyl peroxide? Oh, yeah, can for now. No, please, oh, I did not. I said you have to take it stepwise, okay, from beginning to the end. So, guys, thank you so much for joining this live, because I am so glad that I could actually give this lecture and explain it so well for you guys. I hope I did. I hope I did. But I'm sure that anybody who is an oil skin type person, the skin type has an oil skin type, and attended this class, because I'll call it a class, or attended this class, should know now by now that they can conquer that they're oily skin, and you know get everything sorted out. So guys, I'm so happy that I could do this. I'm so happy that you joined to the end of this live. Thank you so much. I hope you give this live a thumbs up. I hope you do. Our next live, I'll be explaining to you guys what what's that one? Um, the skincare routine for a dry skin type. That's what we'll be doing on our next live tomorrow. A skincare routine for a dry skin type. So if you have anybody who would actually benefit from this lecture or from this class or from whatever I have to say, please do well to signal the person. Share this live to whoever that will want to learn from it, or you feel that will benefit from it, or at least teach them what you've learned from here. So my next live will be on skincare routine, ideal skincare routine for a dry skin type. Thank you so much for joining this live. I appreciate you. My name is Dr. Wendy Okbala. I am a small YouTuber based in Anambra State. I'm sorry I didn't do this intro in the beginning, but I have to. So I'm a small YouTuber based in Anambra State. I am a medical esthetician. You can call me an aesthetic physician. So whatever I'm teaching you here, I know this for sure. You can take my word for it. Okay. So guys, see you guys on my next live tomorrow. Bye.